What's going on, everyone? This is Dr. Todd from Move Now Chiropractor, and this is episode number 294. I'm going to talk about some expert witness work that I've been doing over the last couple of years as far as backing up chiropractors that are being sued. And I feel like they're wrongfully being sued. So I take on the case and I get to look through records and do all kinds of stuff. And I want to share what I've learned from that and what you can do in your practice to protect you. So this is a really important one. Slightly change of topic, but I think it's relevant because, hey, trust me, I'm an expert, right? Who else said that? Fauci, this guy. I got Danny on here too. We're going to pull her on in a second, but you can listen to our intro and we're going to get going. Here's what so many chiropractors have been searching for. How can we expand our clinical reach by finally addressing more than just the segmental component with our patients, but at the same time, not feel like we are selling out our chiropractic principles? The reality is our patients count on us to guide them. And when it comes to results, we must also address their posture and their movement. The verdict is out. Patients have spoken, and this is what they want and what they need, focusing on functional movement and corrective exercise. So how do we practice in a way where our community is engaged, excited, and seeking us out because of this comprehensive, results-based approach? That's the goal we've all been searching for, and this podcast will show you how. My name is Dr. Todd Pickman, and welcome to the Move Now Chiropractor. All right, you got Danny on here now. Surprise, surprise. Say hi, Danny.
Hi.
I was talking with Danny prior to this and just figuring out if there's some questions that she can throw in there along the way. So it's not just a, 20-minute episode of me talking and having Danny in the corner. But even if that is, at least you got someone else to look at instead of just me. Right. Right. She'll be there smiling periodically. What are we talking about today, Danny?
So we are talking about all of your expert witness stuff, what that entails, how did you get into that, what can doctors do to protect themselves in case they find themselves in this situation,
There
all
you
those
go.
fun things.
I just went through and sent some Marco Polo messages, which is like a little video chat thing that we use on our phones to communicate with each other, but also with our Move Now doctors. And I use this to talk to Dr. Zach, my associate doctor over at the clinic. And yesterday I left at the clinic a 10-page expert opinion letter that I just wrote on a case that I'm working on, because I felt like it'd be really helpful for my assistant Jenna to see it, because she does a lot of the documentation stuff, and for her to see some of the points that this chiropractor is being sued is being beat up on by the expert witnesses on the plaintiff side. So the sellout chiropractor that wants to testify against chiropractors, and then the medical doctor that doesn't know his, what, from his elbow, trying to comment on chiropractic. It's really a frustrating thing if you find yourself in this position, because you have these so-called experts that know nothing about nothing, and they're trying to pick apart what you're doing, and they'll look at every little thing that you do and try to knock you down. And there's some pretty substantial things that you should just have lined up ahead of time so you don't find yourself in this position. So I'm going to share those with you. But anyway, so I was talking with Dr. Zach, because I left it there for him to read, and he's about halfway through it on his message he sent back to me. And he was telling me, yep, it's really helpful. It's given him a lot of ideas and insight and things that he can do preventatively to make sure he has all the bases covered, which, to be honest, we do a really good job of this to begin with. I'm not saying this to pat ourselves in the back, but our compliance guy, Dr. Perry Barnhill from Fearless Chiropractor, I mean, he works with a lot of clinics. He's told us that as far as how we are with compliance and everything that he understands with that, and he's talking about, like, insurance billing and note taking and all that, that we're pretty much the top clinic he's ever seen, which is good to know. There's some other things you need to know from a legal standpoint, though, if you get sued. And because it's kind of, it was one of these things that I was told early on in practice. It's not a matter of if you're going to get sued, it's when. Because like if you're in practice long enough, you're gonna have something happen that someone's gonna sue you. So have I told you, Danny, how I got into the expert work?
No, that's one thing that I was curious about, is how did you get into all of this?
Okay, so it wasn't really by choice. It was, I got into it because I got sued, and I got sued. Yeah. Oh, really? Yeah. So I got sued because I had a independent contractor working in our clinic, and he was truly independent contractor. We had a contract for it. He operated under that. He was paid as an independent contractor, not as an employee. We did that to create that separation. And and he had his own patient base. He was in practice for 15 plus years prior to coming in and basically, renting a room from us and working in our clinic. And so he had his own patient base, and he had a patient that had a bunch of pre-existing health issues, ended up having a stroke, and had a stroke in the clinic. And the first time I met this patient is when the other doctor ran in and grabbed me and said, "Hey, come in here real quick." And I come in the room, and the guy's laying on the table, and he's basically in process of, having some negative things happen. And we called an ambulance. We got him out of there. Hospital's right across the street from our clinic. So he was stabilized. Found out he had some genetic abnormalities in the circle of Willis inside of his brain, inside of like blood vasculature. He was a chronic alcoholic. I mean, had all kinds of pre-existing things. And there was a immediate feedback from some people we knew at the hospital to say, like, man, he could have done this turning his head to look in traffic, or, and at the time he didn't have a license because he lost it because he had a DWI because he's an alcoholic. And he was in his 50s, but it could have been, if he's just turning to look somewhere, like he was on the brink, right? Happened to walk into our clinic, get adjusted. That's what basically the straw that broke the camel's back. Now, I would have done things a little differently than this other doctor, but not incredibly. There was some things I would have done differently. But anyway, I got sued because they sue everyone in sight. And so long story short, I went through that process. It wasn't a very fun process for me. I had enough stuff on my plate just dealing with, running a practice and everything else in life. So I get roped into this. They try to beat up to say that our contract that showed he was an independent contractor wasn't legit because of things like he had a shirt with the same logo as my shirt. So if he was truly an independent contractor, he would have a different name. He would have business cards with a different name. He would have a different person answering the phone for him. I mean, the things that they tried to do to say that, no, he couldn't just be an independent contractor and like work in the same clinic was pretty disingenuous, to say the least. But it stuck, and it stuck enough for them to branch out that whole umbrella of trying to attack me. But here's something he didn't do that we told him he needed to do, and stupid me, I didn't make him prove that he did it. So here's tip number one. Ready? Todd's tip number one on how to protect yourself when you're sued. Tip number one, here's how I'm going to pull Danny into this.
Okay.
I'm going to give her hints. I'm going to see if she can guess what this is. And she might have no idea on this, so don't fault her, because this is kind of a very convoluted topic. But okay, so has to do with malpractice insurance. So you might actually know about this because it's something that we have done with our other doctors and other therapists, like our massage therapists. We even did it with them, is that they have to do something on their malpractice policy that gives us another level of separation and protection. Let's see. Do you know what it is? If I had like the music.
They have to carry their own malpractice insurance. I know
Yes,
that they have to be a separate entity. As far as specifically something special that they have to do.
Okay. So maybe you and I have never talked about this before. So it's called, what they have to do is when they get their coverage, we require them that you have to name our clinic as a additional insured. What that means is that essentially if they get sued, they are paying a little bit more for their own coverage to basically give us protection as well. I can't tell you all the like logistical lingo, that terminology, but naming the clinic as an additional insured is something that gives you a level of protection. So make sure your associate doctors do that. Make sure any independent contractors do it. Anyone else that is like a treating provider, a massage therapist, like have them do that. That's what we did with our massage therapist. That's what I've done I'm doing that with Dr. Zach right now. He's an associate doctor. He is set up as an employee. For sure, if he gets sued, they're going to sue me. Like, that's just how it works. And that's accepted. But if he has it set up, we're named as an additional insured. I think it costs him like maybe another $100 to $300 a year. So it's not that much more. Like most malpractice insurance policies for chiropractors are around $2,000 to $3,000 a year. Very inexpensive malpractice insurance because chiropractic is incredibly safe. That's why it's so low for the premiums. Okay.
Yeah.
All right. So that's trivia number one. So anyway, to tell the story, the way I got involved in it, I got sued. I had to represent myself, and I had an attorney that was assigned to me from my malpractice and carrier, from my malpractice carrier. And so we go this whole way, and how it works when you get sued or when there's a lawsuit is first you get served. And I remember someone came to the clinic and it was like out of a movie. They're like, "Are you Dr. Todd Pickman?" "Yes, I am." "You got served." And he like hands me paperwork and I'm like, "What?" It's so weird. And then I open it and it's this lawsuit, it's like, this person against, you know, you bad guy. Right. And so like immediately you just like have this feeling like, oh my God, going to jail. What's wrong? My life's over. And then you get assigned a attorney from your malpractice carrier, and they help you understand it and whatnot. First, I was like, why am I even getting sued? I've literally met this patient for 5 seconds. I had nothing to do with this. But like I said, they'll sue whoever's around. Okay.
Yep.
So then what happened is, long story short, I worked with this attorney, my malpractice carrier, my malpractice carrier, I keep saying that word, sent one of their representatives out when I did a mediation, because that's the way it works is first you get sued. Then they say, do you have some kind of settlement to offer? And then when we say, no, we didn't do anything wrong. What do you mean? We're not offering anything. Then they say, okay, fine. And then it goes back and forth for a while, and they have experts that write letters, and that ties into now, like, that's me. I'm now that expert on the chiropractic side. And then what happens is then they oftentimes go to mediation, and mediation is you basically sit in a room. So it's like me, my attorney, and then you get this old retired judge that doesn't act as a judge anymore. He acts as a mediator, and he'll come in and he'll be like, hey guys, this is a bad case and it's going to look bad in court. The jury's going to be sympathetic to this person, and, it's probably going to be a problem. So, you should probably pay out something. Right. And like, that's how they start. And then on our side, they're like, well, most we'll pay is $100,000. Okay. Like, it's literally like that. That's how it starts. And then he leaves, goes in another room. And then in the other room is the injured party. And he's like, no, I want $2 million. And then they go to the other chiropractor, who was my independent contractor, who, dragged me down with it. And mind you, he dragged me down with it. So he was someone that we had fired for other reasons. And I don't communicate with this guy. I should have never gotten involved with him to begin with. But he and his attorney, they were the ones that were pushing to say that he was an employee, just so they could try to like put more problems on me and take some of the weight off of them. So that was their approach. Okay. Shady mofos. So then what happened is we went through this literally an entire day of mediation, like 8 a.m. to 5 p.m. I sat in a room that long, got to leave, eat lunch, come back all day long. And I'm sitting with my attorney and this representative from the malpractice insurance that represents me, or that, that I pay for. Right. And so anyway, after that, at the very end of it, they said, hey, Dr. Pickman, do you ever do any expert witness work? Because, it's obvious you know what you're doing and you handle yourself well. And they said a bunch of other nice things. And I was like, no, I haven't. And they asked me if I'd be interested. And I said, sure. And then like a month later, they asked me if I wanted to give my expert opinion on a case. And so I've done like 5 of them since then. That started probably back in 2015, maybe. And I'd like to do more. I actually enjoy doing it. And there are experts in chiropractic that will swing both ways. I don't swing both ways. I only swing one way. Right. So meaning they will support suing chiropractors, and they will attack fellow chiropractors, and they have ones that will defend. I've been offered to attack fellow chiropractors, and I say, nope, not interested. I just, I'll let someone else do that. And then they present a case and they say, hey, here's the case. Do you think you can give us your opinion on it? And if it's a case where I think like the chiropractor is being wrongfully sued, then I'm like, yeah, I'll look at it. So I've done these, and how it works when you're an expert is they send me all the documentation. They send me all the notes. So guess what I see when I see all these doctors' notes?
Faults. Things
Faults.
that are wrong, not compliant. adjustment.
Oh yeah.
Things are missing.
Oh yeah. You got it.
Yeah.
So that's
Hmm.
some of the stuff I wanted to talk to you about on this little conversation here is things that need to be ramped up with the notes. Dr. Perry Barnhill, I mentioned his name earlier from Fearless Chiropractor. He can help with a lot of these things for sure. Main thing I would say is like main thing that maybe you don't think of as the chiropractor, depending on what technique you do, you might not be in a habit of listing segments that you adjust. Okay. So that's actually a thing, Danny. Like there's chiropractors that don't list what segment they adjust. They say
Oh,
like,
I know.
yeah. So they're like
Yeah.
adjusted cervical spine. What does that mean? Did you adjust C1, C2, C7? What did you adjust? Because now this person's suing you for a C6 disc herniation. And if you said you stayed far away from there, it strengthens your case that you didn't cause it. One is listing the segment that you adjusted. The second one is one that 99% of chiropractors don't do this. I have always done this because this is how I learned it from day one when I worked for the chiropractor in New Mexico. And that is, again, I'll make this like drum roll guesswork. It has to do with not just listing what you adjusted. And I know that you're familiar with our notes, Danny, so you'll
Hmm.
probably figure this out. So not just what you adjusted, but what other variables around that do you think there could be? As far as, again, talking about like in the plan section of the SOAP of the SOAP note on a
Is
daily.
it like how the patient adjusted, how the adjustment went, how they were moving, their response to the adjustment?
Yep. It's a couple of things. It's what technique did you use? Okay. So for us at Gonstead Spine and Wellness, we only do Gonstead when we're adjusting a joint. Okay.
Hmm.
So, but in our macro note, if you see it, it says every single time Gonstead adjust, or like according to Gonstead system, like this is the type of adjustment. And it says that repetitiously over and over and over again. On a side note, if I can hit pause on that real quick, in this current one that I just finished my opinion report for, the thing that they were going after this doctor for, who is a Gonstead doctor, is the expert on the other end said, well, it's unclear what technique you use. You didn't list what technique you used and blah, blah, blah. And it's like this doctor literally has on his paperwork, like experience the Gonstead difference. And he says, I'm a Gonstead chiropractor. And so it's like, no, he does Gonstead. And that's obvious. That's what he did. So even though he didn't note that every single time, and his notes were on more or less of like an old school, just like adjustment one line of you just write what segments you adjusted and you write some little scribble handwritten notes if there's something to notate. But on a lot of the dates of service, it's like stamped date and then like C7, T6, L5. That's it. Like nothing else. So it wasn't even a SOAP note. Okay. Like, cause it didn't cover subjective, objective assessment plan. It was just like plan, like what was adjusted each time. So what I would recommend is if you do different techniques, if you do like drop table, if you do activator, if you do diversified, if you do a Gonstead move or something, set that up in your note macros. List out how you adjust something. Take a few more seconds to list out how you adjust something, like what technique you use. But then also like what Danny was saying, how the patient responded to it. Yes, like if the patient, it hurt them afterwards, they said, oh man, that really felt good. Make a note of that. Patient responded favorably to care, said that felt good, or could tell that their range of motion freed up immediately or their pain decreased immediately. Like make a note of that, like note the positive for sure, but also grade how well it adjusted. That measures or gives feedback on how much force you used. So how we do that, like on our notes, Danny, how we have like +1, +2,
Yeah.
+3, +4. So
Hmm.
that's a system I learned early on in care, is to always grade your adjustment. So in our grading system, +4 is like it moved a lot. In my mind, it's like +4 is not necessarily what I'm looking for. +3 is like pretty good, tolerable. Probably not going to make the person sore because, I rocked them and kind of moved it maybe a little too much. Um, a star. So it's like +0 is it didn't move. +1 is it barely moved. 2 is a little more. +3 is pretty good. +4 is it moved a lot. And if you moved it any more than a +4, you're probably going to have that person saying, ow, Like I have some negative residual from it. And then a star, which is another thing we put on there. A star is like the perfect adjustment. Like, oh my gosh, I've adjusted this person 15 times. And now finally we had that perfect adjustment. That's like the star, right? So it moved just the right amount. Person did really great. Have some kind of grading system like that, because that came up in this. Their expert was saying, well, how do you know how much force you used in this and this and this? So it's like, if you can be a step ahead of everything that these experts are trying to beat you up on, it makes it that much easier for an expert who's hired to defend you can point to it and say, look, here's what the doctor laid out with all of their documentation. Read it and weep, type of thing. Okay.
Yeah.
So that was the second thing. Let's see some other things. Noting positive and negative. Okay. So like a lot of doctors get in a habit where they'll only make a note if something's negative. And if something was like okay or positive, they just say nothing.
Yeah.
And the problem with that, what do you think the problem with that is? Let's see if we can.
The problem with that is that nobody knows the positive. They're only focusing on the negative. So then when somebody calls you out on the negative, you've got nothing to support it.
There you go. And so like in this case, so this is a perfect case. This patient was so thrilled with how this chiropractor worked on him and did such a great job that they left a Google review, positive Google review. Oh my gosh, this has worked so great. Help me considerably, right? The doctor never noted in their notes how well the patient was doing or how well they responded. And 90% of the care that doctor rendered to them before the incident in question, the patient was doing awesome. Then what happened is the patient had a new symptom they came in with. Wasn't even a big deal of a symptom. It was a type of like muscle achy type stuff. And the doctor worked on them. And then the patient didn't really get better. And then the patient flared up the next day doing some other activity on their own. And they reported it and he documented it. And then the doctor ended up saying, let's send you out to get an MRI. Well, a couple of weeks later, patient came back. Yeah, I got an MRI. They said it was negative. So the patient's relaying that information to the doctor. Don't take their word on it either. Ask for some kind of report or something, or, take their word on it, but make a note that the patient relayed this. I asked for them to bring me the report. I asked for them to send me the image so I can look at it myself. Anyway, what happened is that patient disappears. And then 2 years later, that doctor gets served with a lawsuit saying that they caused a disc herniation. Okay. Like that's literally how it played out. He had no idea there was even something that negative going on. And like, I don't want to share all the details of this thing because it's still somewhat fresh. So I'm being a little bit vague on these details, but because it's probably going to go to court and I'll be testifying in court and whatnot. But with that said, it was just, it was like looking at all the steps of where things could have been improved would have made it that much easier to probably have this thing not even go this far to begin with, because it's like if every I was dotted and T was crossed, and then this patient goes to an attorney to say, I want to sue this chiropractor, and they start the lawsuit and they go through that discovery phase and they start asking for documentation and notes, and then they start looking at it, they're going, I'm going to get my butt handed to me on a platter. So I'm not even going to push this. But if they look at it and they go, the doctor's documentation is bad. Yeah, we can beat them up on that. And then that's what they get their expert to do. And the expert just tries to beat them up on documentation, which poor documentation doesn't mean you did something bad clinically, but if you didn't write it down, it never happened. Mm-hmm. That's like kind of the whole saying. So let's see. What else on this case?
Well, what about staff documentation? So a lot of times patients will say things when they leave the adjustment room and staff hears it. Could that be something that's used in this? Because I know we document everything, every encounter that we have with patients, document it in their notes. We send you emails, updates, all of that stuff. So can that come into play?
Yeah. And that's super rare for people to do that. And there's even areas where like we could do that better. For example, like
for sure,
like on our end, every time a patient has some positive outcome for whatever staff person in what department they hear it, whether it's traction or exercise, it'd be pretty cool if they noted that. hey, today
Yeah.
Mr. Jones told me he slept better and he's so happy with how traction's going. And like, man, it's the first time he's able to touch his toes. He's thrilled. He's got a smile from ear to ear and talking about how happy he is and his wife's so happy. Like they might tell someone else that, but they don't tell the doctor that,
Yeah.
you know?
It would be nice if, because sometimes in our chat, which we've talked about before, but in our little chat system, they'll put that information in there, but I don't think we ever put it into the patient's account to where we can go back and reference
Are
it.
we, and so here's a question for you, and just to share
Uh-huh.
this with everyone else. So like how we communicate in the office, we use this thing called O Messenger, and it's just like a instant messenger chat. You can have group chat and whatnot. We talk to each other in that. Danny works remotely a lot of the time, so she'll be logged into that from home and she'll see the communication happening in the clinic. She'll be able to intervene, help out from a distance. That's how me in the adjusting room with Jenna, my assistant, that's how we talk to the front desk. That's how we talk to the exercise department, traction, everything, unless we have to go physically in person and go do it. My question is, are those chats automatically archived somewhere where they're all saved, or do we have to manually save them?
So both. We
Okay.
do both. Yeah.
Okay.
So you can go back and search it, and then we always copy and paste into a Word document. So that way we have it. So we do have backup there if there's ever any positive or negative that we have to go back and reference.
Okay.
For just it being easier, we should always copy that over into the patient's note
To the
section
note.
in
Yeah.
their
So
ChiroTouch.
so then are we do is that a standard that we do like at the end of the day, we take the entire chat, highlight the whole thing, paste it into a Word document and save it?
Yes.
Okay, cool. All right.
Mhm.
Well, we're on the ball with that then. So then that's something that would be admissible in court to have this real life message. So it's like doing that, saving that. So you have all the chat messages per day, but it's a little bit like finding a needle in a haystack if you don't have it pulled into the patient's account. But if, staff's like, oh yeah, they were doing great. Okay, well, now you start sifting through those notes, you find it. Aha, here's proof that the patient said that they were doing so great. Because in this case, what's happened is the expert on the plaintiff side, on the other side, is trying to claim that this doctor saw this patient for 10 weeks with no positive response. So didn't follow the standard of care, should have referred them elsewhere because they saw them so much with no response, which was like not even what the patient said when they were deposed in their deposition. They were asked, were they happy with this doctor's care? Oh, yeah. Did this doctor provide you a lot of relief? Oh, yeah. He did better than most other chiropractors. He was able to do X, Y, and Z that other chiropractors weren't able to do. Okay. So then is it fair to say that you were satisfied with everything in his mannerisms and interactions from this date to this date? Yes, I was. Okay. And then this date, this is where you have a problem. So that now right there in the deposition of the patient contradicts what their own expert tried to assert, saying that this patient was treated, recklessly because they had this problem the whole time and the doctor was never able to help them and they didn't refer them anywhere. So document positives is what I'm saying. Document positives. This doctor didn't document positives. So fortunately, they were able to pull it out of the patient when they deposed him because he admitted it himself. Right. But what if the patient wanted to lie? Nope, I never did better at all. Everything was bad. And because if they're suing you and it's kind of like a frivolous lawsuit like this, believe me, they will remember things completely different. Like a famous quote that my mentor told me that reigns true with this, because it's not even that they're intentionally lying. It's that you're only as good as your last adjustment. So, meaning you could have like parted the Red Sea and like done amazing things for your patient and like help them, get rid of headaches they had for 20 years and, just everything. But that one day that something happened that they remember that wasn't favorable, you're the worst person in the world. You never helped them. So that's a piece on that. Okay. I can keep going. Any thoughts on this or questions so far?
No, I mean, just coming from an office manager standpoint, making sure that everything is noted all the way around. So that way it's not just on you to document these things, but the staff is also aware of what needs to be documented, all the compliance stuff. If patient says something up front that you feel should be relayed to the doctor before they even get adjusted, what their role is in all of this as well.
Something else too that kind of comes to mind in that is that if a patient says something at the front desk that's somewhat accusatory or controversial in some way, don't don't see them in the adjusting room and not say anything about it.
Yeah.
Like as the doctor, address it. And so this little saying that my mentor back in the day used to tell me is always run towards the fire, always run towards the danger. Meaning someone says something, call them out on it in a nice way. Like they come back into the adjusting room, however your clinic's set up, you say, Mr. Jones, so I understand that you just expressed to the front desk that you were upset about X, Y, and Z. Let's talk about that. And you
Mhm.
just call them out on it. And sometimes what'll happen, these patients, some of them they've always operated where they'll go and like basically talk trash to the front desk. And then they think that they don't communicate with a doctor or something, or they don't want to say something. And then you ask them about it, and then they kind of tone down what they say. And then you
Mhm.
work through it and you figure out where the story really is. And maybe it was like emotionally driven and they kind of exaggerated it, to someone else in the front. And then you make a note of that conversation.
Yeah.
So those are things. Let's see. Something we pulled up on the screen that I wanted to talk about is informed consent. And this is something that, let's just paint the picture of this. Okay. Let's say, okay, first off, informed consent has to happen before you ever touch the patient.
Yep.
So day one has to be signed. If it's not signed, you cannot touch the patient. You should not, because you're setting yourself up for a potential problem. I've seen informed consent on different chiropractors' offices, and I would say a lot of them are lacking. Um, Ours could say more, but ours is pretty good. Ours talks about even the most controversial of things that chiropractors get sued for, which is stroke. Okay.
Mhm.
And on two of the cases that I represented chiropractors, it was for stroke.
Yeah.
So, and side note, well, what happens with stroke? Patients are in the process of having a stroke. They go see a chiropractor because they have neck pain or headaches. Chiropractor adjusts them or sometimes does nothing. Patient has a stroke either right there or thereafter. Go to the emergency room. Emergency room says the chiropractor caused the stroke. They tore your vertebral artery. They did X, Y, and Z. When the fact of the matter is, this patient had the process occurring. It was in process. The chiropractor was typically that unfortunate provider that they went to where the hand grenade went off, and now it's correlation is causation, and they're blaming the chiropractor on causing it when it really wasn't their fault.
Yeah.
So in those cases, it's being able to identify red flags and be so super cautious that if you feel like you need to refer the person out before you touch them, you do it, or you at least explain to them what it could be. You ask the right questions. So like side note, and I'll show you our informed consent on day one that we have, just to give you an idea. But like, let's say that you've taken care of Mary Jones for 6 months, and she came in initially for some neck pain, low back pain, whatever, and you worked on her. She's done well. She gets headaches periodically, but it's not a big deal. Well, then she comes in one day and she says, I had the worst headache of my life. Okay. Like, little bell should go off in your head. Be like, you've never had a headache like this before? No. Okay. Let's talk about this. I will literally have this conversation with a patient if they say something that alludes to that. I will say, Mary, you have to understand that phrase you just used, worst headache of my life. We're actually taught to have that go off as a red flag, that if you're not someone that's experienced this before, worst case scenario, this could be some sort of blood vessel that has broken or is compromised, or a stroke. Okay. Which could be really serious. So options are, we can stop doing what we're doing right now and send you to the emergency room immediately. And they can do some special imaging of your head, and they can see if anything's going on like that. And they might just tell you, no, nothing's wrong, and then send you right back over here. That's one option. Second option is we proceed with caution. We see how you respond after this visit. If it gets worse or if it doesn't get any better, then you go get the special imaging. But as I'm telling you right now, there is a small risk that this is something like XYZ going on. And by adjusting you right now, probably not going to make it worse, but it very well could. If it's in process, it could. But what I'm going to do is I'm going to work on some areas in your spine that I think are safer to work on. I'm going to work on your lower cervical spine. I'm going to make sure I don't rotate your spine at all with the adjustment, which in Gonstead, we're pretty much covered there because we don't rotate any part of the spine. But if you go and you're adjusting like Atlas, which, translates left or right, like subluxates left or right, and you're setting it from right to left or from left to right, and they already have this compromising issue and they have a problem in their vertebral artery, well, that a little bit of side to side motion could be enough to just take something that's already in process and push it to the next step a little easier. And now that person's going to go to the emergency room. The doctors at the emergency room are going to plant that idea in their mind as hard as they can. I've seen it before. And they're going to say, you should never get adjusted. That doc, and they'll say things that are just completely unfounded, slanderous, should be illegal, which on the same note, you as a chiropractor, don't say something negative about someone else's care unless you actually understand it and know who this other doctor is and really understand their thought process. So that's something else too. Like don't be quick to badmouth some medical doctor who's taking care of your patient and put them on some kind of medication if you don't understand the whole circle of what's going on. So ask those questions, because patients will also pick up on that if you're quick to, put someone else down. On the flip side, pick up on that with your patients. If your patients come in and every doctor that they saw in the past was an idiot and screwed them up and they hate everyone, you're next.
Mm-hmm.
So find these red flags, because you will be the next person that screwed them up, that, further adds to their victimhood list.
Yep.
Let's see. What else? I don't know. Anything I've said that's giving you some ideas of questions, or should I keep rambling on?
I don't think ideas of questions. My mind is turning right now with things that I can discuss with the staff as far as their part in all of this that maybe they may not be aware of. So that's where my mind is at right now.
Just as far as getting them to make sure that they're documenting both positive, negative,
Mm-hmm.
relaying that back to the doctor, positive and negative, but yeah.
Yeah. And understanding patients' comments when they call in. If the patient calls in, it's like, I need to get in right away, I'm having the worst headache of my life. That should be an immediate trigger for our staff to let the doctor know immediately before they even come in that this is taking place. And maybe if they say some other key things that this may not be normal, that we let the doctor know right away and not just like, okay, yeah, we have an opening at this time, come on in. Mm-hmm. Things that our front desk staff can take a little bit more seriously and get that information over to the doctor sooner.
Yeah, for sure. Or especially if someone calls in and it's like a Wednesday and they're like, oh my gosh, I have horrible vertigo, worst headache of my life, just came out of nowhere. I've never had this before. Half my face is numb. My left arm is numb. Yeah. And then the staff's like, well, we're totally full. We can get you in next Wednesday, and then it's like, or you say, those are really sound like some pretty severe symptoms you have, but I'm going to pass this on to the doctor. While as we may not have an opening, that's convenient here, I'll see if he can, possibly give you a call back, discuss that with you, or see if we do have an opening, we can make a little earlier or whatever. And then they might come tell me that. And I call the person on a lunch break and be like, what's going on, Mary? You should probably go to the emergency room and get checked out. That sounds, get checked out first, make sure, it rule out something life-threatening. And then at that point we can get you in.
Yeah.
Yeah.
I think it's important for, front desk to understand all of these concepts as well. And obviously with the informed consent, there are times where the patient is going through their paperwork and their questionnaires that they have as far as like their symptoms and neck index, stuff like that. It's like, well, let's get you in consult. You can finish in there. There's certain things that need to be done before you set them in consult. Mm-hmm. And number one is that informed consent. Any signatures that the patient needs to read and sign, those need to be done before you put them in their room.
And on that note of informed consent, you need to have informed consent in the beginning. And then anytime there's any sort of little red flags, anytime something goes off in your mind, like this is a new symptom, new problem, have the conversation with the patient and make a note that you had the conversation. So let's say the patient has a really bad knot in their upper back. I mean, that's like literally this case that I'm working on right now, which it's not the typical stuff that you would think would be, you know, like a possible disc issue or something bad like that. You'd think like this is a normal everyday thing we see with chiropractic. And even when you put someone face down on a table and you adjust them, especially if they're a little bit hyperkyphotic, if they have increased thoracic curve, you put them face down and you're pushing in their upper thoracic area, it's going to flatten out that thoracic kyphosis. And in the flattening process, the spinal cord and the spinal nerve roots inside are going to undergo a little long axis distraction. It's going to stretch the nerve fibers a little bit. So it's not uncommon. Like I feel this almost all the time when I get my upper thoracic spine adjusted. I'll feel a little bit of tingling down my arm. And sometimes if I get a hard adjustment, I'll feel more tingling down my arm. And it might, give me like a zinger, and it goes away. It doesn't last very long. But those are things you should have that conversation with the patient. If they tell you, well, I felt that down my arm. If they say that, you should note that, and you should explain to the patient. You should say, that's pretty common. Here's why that's common. Worst case scenario, that adjustment is helping uncover that you might have an underlying issue with a disc that's pressing up against something. Might not be a bad idea to explore that further and get an MRI, or if anything changes or gets worse, you let me know. Because this adjustment could be exposing something that's already going on with you that you didn't know about. Very different than this adjustment just caused a herniated disc and did this to you. No, it's pretty much impossible that this type of adjustment's going to do that. And, I wouldn't start going into that conversation or like debate with the patient, but it's like you pre-frame it. You're setting this up before there's an objection, before there's a problem, because someone's going to plant an idea in that person's head that, hey, this degenerated disc that then blew out that, happened from 20 years ago, it was all caused by the chiropractor, and it's like, no, that's just not the way things work. It's like certain patients, unfortunately, are damaged goods when they come in and they see you, and you need to point that out to them so they understand like how long these things take to come about, that like just, especially in the realm of even functional movement and traction, we're putting patients' bodies in positions that they haven't been in 20 years. They've never tested the waters before to even see if I just stand upright and like move around a little bit, does my body function properly? They might do that in an exercise and then feel numbness or a like nerve stretch into their arm, thinking, oh my gosh, I have a problem now. It's like, no, you didn't know you had a problem this last 20 years because you've walked like this the whole time, all hunched forward. Those are things to just communicate that with a patient and have like a button. If, I'm sure everyone on this has electronic health records. You have macros, you have buttons. Make a macro that says, hey, patient presented today with a new type of sensation. I took time to readdress informed consent as it relates to this, and then type a little unique sentence. Patient had numbness into the right arm after an adjustment. Boom, boom. I explained this can be from, potential bulge disc that they've had for a long time. Putting them in this position could have caught their attention as to that this was a underlying problem that they weren't aware of. Told them to keep me posted on how it does. If it gets any worse, doesn't go away, then this would be a good trigger to go and get an MRI so we can dig deeper on this pre-existing pathology, right? Patient said they understood. They still wanted to move forward and do all their other services today. Or, patient comes in, presents, tells you a symptom before you adjust them. Hey, have this conversation with the patient, let them know, here's what it could be. Here's the pros and cons of moving forward with care as planned today, or stopping what we're doing immediately and going and getting special imaging. So like, as laborious as that might seem, have a macro, spend an extra 10, 20 seconds, note it at the end of the shift if you don't have time, right there on the fly. Very, very important. All right, we're 44 minutes into this already. I was trying to make it 20 minutes. So, and I got more I could even cover, but hey, maybe we can save that for another time. So let's just share the screen real quick. This is going to be tough for our podcast listeners that are not seeing this visually, but we can read it. Maybe I'll let Danny read it because I've been talking the whole time. All right. So this is in our new patient paperwork. So we have all this stuff here. You also got to put a bunch of stuff in about HIPAA and all that sort of thing. So scrolling down, we're looking at my screen. So we get a couple pages in. So you have the healthcare authorization form, HIPAA. That's all Dr. Perry Barnhill from Fearless Chiropractor can make sure you're dialed in with that. We're dialed in with that. You're giving our clinic permission to do all the HIPAA stuff. Here's informed consent for chiropractic care. Okay, so what does this say for the most part, Daniel? I'll make this nice and big so you can
Thank you.
read
I
it.
don't have my glasses on.
Okay.
Do you want me to read it word for word, or do you want me to summarize it?
You know what? Why don't you read it word for word? Let's do that.
Sure. Chiropractic care, like all forms of healthcare, while offering considerable benefit, may also provide some level of risk. The level of risk is most often very minimal, yet in rare cases, injury has been associated with chiropractic care. The types of complications that have been reported secondary to chiropractic care include sprain, strain injuries, irritation of the disc condition, rarely fractures. One of the rarest complications associated with chiropractic care, occurring at a rate between 1 instance per 1 million to 1 per 2 million cervical spine neck adjustments, may be vertebral artery injury that could lead to stroke.
Yeah. So, okay. So we had this in our informed consent when we got sued for a patient who had a stroke. Okay. And so we showed them, we even take the biggest elephant in the room and we put it in our informed consent paperwork, and the patient signed it and said they understand that this is a very rare thing. Well, the other side, when back in the day when we first got sued, tried to actually take this 1 million to 1 per 2 million quote and try to say, no, it happens more commonly than that. So this was misleading. And then we pulled up the actual papers that support this and said, nope, here's where we got it from. And so that point wasn't a point that they could push anymore, that we didn't have proper informed consent. We had proper informed consent on day one. Like we talked about before getting into this, though, patient presents with a new complaint, something that's, sketchy. Talk about this again, document it again before you move forward with something. Okay, continue. So prior to
receiving chiropractic care, this chiropractic office, a health history and physical examination will be completed. These procedures are performed to assess your specific condition, your overall health, and in particular, your spine health. These procedures will assist us in determining if chiropractic care is needed or if any further examinations or studies are needed. In addition, they will help us determine if there is any reason to modify your care or provide you with a referral to another healthcare provider. All relevant findings will be reported to you along with a care plan prior to beginning care.
There you go. And I realize that there's a grammatical error in there. It says prior to receiving chiropractic care, this chiropractic, it should say in this chiropractic office. Maybe we can fix that on our next version of this. We've had this for so many years and I just realized there's a typo. All right. So essentially, and then below that, I understand and accept that there are risks associated with chiropractic care. Give my consent to the examinations that the doctor deems necessary and to chiropractic care, including spinal and extremity adjustments as reported following my assessment. So they cite it. Now, I'm not saying that you have to have a paperwork like this every time the person comes in with any new complaint, but have the conversation, make a note. That's the part I wanted to wrap this up on with informed consent. So hopefully we went through and I gave you some good tips that maybe you're not doing in practice that you could spruce up. You could share this with your other doctors in your clinic. You could share it with your office manager, your staff, so they can take some of the tips. Having a messenger system in your office is not just a convenient way to communicate between staff, but it's also a good written record of what's going on in the clinic. So it's also something that would be admissible in court to back up what happened that day. So don't put anything dumb in there that you don't want on the front page in the newspaper. Okay, because might happen. I'm thinking all the dumb things I write in chat sometimes. Fortunately, I'm not on chat very much. It's filtered through Jenna, my assistant. So she writes it. I don't write it. And then also to have a couple different chats going so that you have one chat that is like communicating on this, and you might have more of like a freestyle chat somewhere else that if you want to be goofy or something, you can write stuff on that, but it's not really where you'd put the professional stuff in so that you can keep it separate, because sometimes on chat, people want to have fun and put little emojis and that sort of thing. But then again, like you don't have time to do that. You're seeing patients, you're busy. You don't have time to, find some funny gif of a guy like head banging when he's doing construction work. Remember the one I sent you this morning?
Yep.
In text message, though. That was in text message. Yeah. Here, I'll show that on the screen for those that are watching this. That'll be a little bonus if you watch this. It's a funny one. I don't know what it was. Oh, I was asking about a diagnosis and you said diagnose as you see fit. And then I don't know why I sent you this, but I sent you that. Right. And this guy's doing construction while he's headbanging. Anyway, there you go. See it better. It's hilarious. I don't know why it's funny, but it is. Anyway, all right, cool. Well, Danny, thanks for jumping on this and doing your best to question and make it interactive, so it wasn't just me talking to myself for 45, 50 minutes. Let us know, as far as you doctors and everyone out there in the audience, what you want to see more of. Comment on this below if you're watching on YouTube. Like it, subscribe, do all that stuff. Follow us where you follow podcasts. Shoot us an email back if you get this via email and you just watched it via email. Let us know what you think, if you appreciate it, what you got from it, if you have questions, all that good stuff. Listen to our outro. We got some links in there on how to take action if you want to see our book or see our demo on our program. And we have an event coming up pretty soon, Impact, April 14, 15, right?
Yep.
April 14, 15, 2023 out here in Meridian, Idaho at our beautiful clinic, Gonset Spine and Wellness. And we'll have digital motion x-ray installed by that point too. So you can come check out our newest technology, which is awesome. We're going to be talking all about that too, because we got some cool stuff coming down the clinical pipeline with DMX. I'm looking forward to it. And so is Danny. She wants to get everything DMX to see how all her joints are moving. Right. She's like, I didn't know that, but I guess I volunteered. All right, cool. All right, everyone, over and out. Here's the outro. We'll see you on the next one. Want more Move Now secrets? If so, then go get your copy of my best-selling book and watch my 30-minute behind-the-scenes Move Now demo. My book is called Move Well Secrets, and you can get your free copy at book.movenowyou.com. And watch the 30-minute demo of our exclusive doctor training portal at demo.movenowyou.com. With these two resources, you'll find my top 22 secrets that we've used to build one of the smoothest running, results producing, and super profitable exercise departments within a chiropractic clinic in the entire profession.